Pursue the quality of life. Total solution for POC diagnostics by SD BioSensor. Notification for COVID-19 antigen tests. This test is mentioned in ICMR advisory issued on 14 June 2020 on the use of rapid antigen detection test for COVID-19. This product should be used strictly as per ICMR advisory for use of rapid antigen detection test for COVID-19. Negative results do not rule out SARS-CoV-2 infection, particularly in those who have been in contact with RT-PCR confirmed COVID-19 case. Follow-up testing with a molecular diagnostics test should be considered to rule out infection in these individuals. Symptomatic individuals who are found negative by rapid antigen card should be compulsorily tested by RT-PCR to confirm the patient result. Results from antigen testing should not be used as the sole basis to diagnose or exclude SARS-CoV-2 infection or to inform infection status. The test procedure should be conducted in ambient temperature and humidity. Results of these tests should be appropriately recorded in the test report. Test kit components for standard Q COVID-19 antigen test. Standard Q rapid test components. COVID-19 antigen test device, individually packed in a foil pouch with desiccant. Sterile swab, extraction buffer tube, paper stand, nozzle cap, instructions for use. Material required for performing the COVID-19 antigen rapid test but not provided. Safety glasses, face mask, disposable gloves, protective suits, timing device or clock, disposable container. Test and sample storage requirement for standard Q COVID-19 antigen test. Test device and buffer tube must be stored at 2 to 40 degrees Celsius. Test procedure for performing standard Q COVID-19 antigen test. It is essential to follow proper infection control measures when samples are collected from patients with a suspected coronavirus infection. The examiner should wear respirator mask, gown, protective glasses, gloves. On test device and extraction buffer tube, you must check the expiry date. Check the expiry date at the back of the foil pouch. Do not use the kit if expiry date has passed. Open the foil pouch. Check the test device and the desiccant. Result window, specimen well. Do not touch the result window and specimen well. Collect nasopharyngeal swab, specimen using provided sterile swab. A patient should be alert and cooperative. Allow them to first blow their nose to make the nasopharynx moist. Tilt the patient's head back slightly and allow it to rest on the back of the chair or against a firm support. Alternatively, support it with your dominant hand. The sample must be collected from both nostrils. Press the swab directly backwards parallel to the base of the left nasopharyngeal passage. The swab should move without resistance until reaching the nasopharynx. Length of the swab inside the nostril should be the same as distance from nostril to outer ear. Once swab is in location, rotate the swab 180 degree and leave in the place for 10 seconds to saturate the swab tip. Remove the swab slowly. Using the same swab, repeat the process in the right nostril. Remove the swab slowly. Remove the aluminium cover of extraction buffer tube. Insert the swab into an extraction buffer tube. Extracting the specimen. Mix the nasopharyngeal specimen with an extraction buffer tube. Stir the swab 10 times. While stirring the swab, squeeze the buffer tube to extract specimen completely. Remove the swab. Applying the extracted specimen, press the nozzle cap tightly onto the tube. Specimen well. Apply 3 drops of extracted specimen to the specimen well of the test device. Read the test result in 15 to 30 minutes. Do not read after 30 minutes. Interpretation of test result. Positive result for COVID-19 antigen test is represented when a pink or red band appears on the control line C and a pink or red band must appear on the test line T of the device. The positive result should be interpreted at the end of 15 minutes. Do not read after 15 minutes. Negative result for COVID-19 antigen test is represented when a pink or red band appears on the control line C and no pink or red band appear on the test line T of the test device. A negative result should be interpreted at the end of 30 minutes and not before 30 minutes. Discard the cassette after recording the result in 30 minutes. Invalid result for COVID-19 antigen test is represented if no pink or red band appears on the control line C, even if a pink or red band appears on the test line T of the test device. The test should be repeated if the test result is invalid. Discard used test materials. Discard used sterile swab. Buffer tube, gloves, protective suit, protective glasses, mask and test device into the disposable container. Important points for performing standard Q-COVID antigen test. Blowing the nose prior to sample collection is important as any excess secretion will dilute the sample quality. The sample must be nasopharyngeal and must be collected from both nostrils. Mix the sample with buffer by rotating 10 times in the buffer tube and squeeze the buffer tube to extract the complete sample. Pursue the quality of life. Total solution for POC diagnostics. SD BioSensor.